Hello guys, this is Brian here with a video. Last night on the news, they were saying that one of our local hospitals is closing its doors. Uh, and it's a big shock and a big surprise. And I got a little commentary because I really don't believe it is. I think they kind of did it to themselves. The hospital system did. Well, actual hospital. The hospital is part of Baylor, Scott, and White healthcare system. And I don't know how many years ago, maybe 5 or more or less, give or take, Baylor healthcare system merged with Scott and White. And I think they were kind of based out of a little bit of West Texas, Scott and White, because they also had their own healthcare plan, Scott and White did. But they're no longer on the exchange, and they're non-for-profit. But yet, they're $50 billion healthcare company, hospital system. Makes you wonder, if they're non-for-profit, how can they have so many billions upon billions upon billions? I kind of get to that in a second. But a week or two ago, they sent me this postcard about the little freestanding emergency room in our little town here. Now, the little freestanding emergency room is just a little emergency room with a couple office buildings. Actually, office building with a little couple doctor's offices. I used to go to, my primary care doctor used to belong to the Baylor system when they built their office complex, another building out here across town. And something went down, but 10 physicians left, including my primary care doctor, because they were in a group, and they went to Presbyterian healthcare system. So I don't know, maybe they saw the writing on the wall that this was going to go down like it did. But of course, this was several years ago. But their little freestanding emergency room sent me this postcard and network in your neighborhood. Well, no, they're not in network. Baylor healthcare system does not take Blue Cross Blue Shield of Texas HMO plans. They only take the PPO. They don't take the new HMO Blue Advantage that was formed at the end of 2015. So basically, that's everybody who is on the individual health care plan or Obamacare who has Blue Cross Blue Shield Texas has Blue Advantage, because Blue Cross got rid of PPOs. Only people who have Blue Cross Blue Shield PPO is employer-based plans, group plans. So they announced yesterday or last night on the news, and I also posted a link to the Dallas Morning News, that Baylor Scott and White Healthcare, Baylor Scott and White Hospital of Garland is closing its doors effective February the 1st or March the 1st of next year. And I've been there before. I had my gallbladder removed there. I think that particular hospital, their quality of care went downhill 10 years ago, but not taking Blue Cross Blue Shield, which is the largest insurer in the state of Texas for the individual market, you alienated a lot of people. A lot of people can't go to the hospital, right? The only hospitals that do take, only Baylor hospitals that do take the Blue Cross is the ones that got merged with Tenet Healthcare, which is a for-profit hospital. So I don't understand how that can really legally happen. How can a hospital be owned half by non-for-profit, half by for-profit healthcare systems? I don't know how that can really happen. Somebody needs to look into that big time. I don't know if it's trying not to save on taxes. I don't know. Because the Lake Point Hospital down the road, 2 miles down the road, is the one that was original a Tenet hospital. Then they got in cahoots with Baylor Scott and White, and now they are building buildings out there and tearing half of it up already. But a lot of people in the community of Garland and the surrounding areas that only has Baylor to go to is going to be affected. Lots of patients. Baylor Scott and White does have their own physician group, which is called Health Texas Provider Network. Um, and the article was saying there's 40 some odd physician offices located on the campus of the hospital out there. And I bet they're all pissed about this. You know, doctors have been out there for decades out there. And we're going to find out, hey, we're not going to have a hospital. You know, why do we need to stay here on campus? You know, a lot of them are going to have to move out, I bet. I mean, what's the point of staying there? Doctors that need to have a hospital, like cardiologists, gastroenterologists, you know, GI doctors, you know, surgeons out there, you know. But for them not to take Blue Cross Blue Shield, I think it's done them in. Because the reason why they're closing supposedly is a lack of patients. Well, if you don't take the largest insurer in the state of Texas, you need a lot of people. But I think Garland is... I think it's going to be a disaster for them, for the people, meaning the patients. They're either going to have to travel into Dallas to get medical care at Presbyterian of Dallas. They're either going to have to go into Richardson at Methodist, or come to Rowlett and Rockwall to the other Baylor, or go to Presbyterian out here. But... And Baylor has been criticized because they're not-for-profit Christian charity, supposedly. But yet they've been criticized for the billing practices. Well, if you're a charity, supposedly, and that's what you non-for-profit as, why are you going after people for co-pays and all this for medical care? Here in Texas, and I'm sure pretty much everywhere else, if a hospital is a non-for-profit hospital by law, well, here in Texas, they have to offer financial assistance regardless who comes to the door. I received financial assistance when I didn't have no $50 copay to pay my emergency room bill. But that also probably... Not to be rude towards anybody, but Garland is, last for 20 some odd years, has become a place for non-U.S. citizens. Let's just leave it as that. So they're not insured, so they end up going to that emergency room. So that also a nail in its coffin too. So I think that, you know, by federal law, whoever comes to that emergency room door, regardless of ability to pay, they had to be treated. What other business do you really know of that works like that, really? I mean, can you go into a department store and walk out with a big old bag full of stuff and not paying? That's kind of shoplifting, but do you think a department store can survive that? you know... That is the weirdest thing, if you really deep down think about that here in the United States, that pretty much that's the only business that people can come through the door and don't have to pay a penny for services and walk out. And we're talking about thousands upon thousands upon thousands of dollars of medical care. You know, let's say the average emergency room visit could be $1,000 to $2,000. Cat, you know, if they don't have insurance. So, you know, I can understand why. That's another reason why people don't understand why healthcare cost is high in the last 40, 50 years. Is because the hospital has to make sure... The hospital has to have markup in order for it to survive, because... They're making a bet that few people who's going to come through that door is never going to pay them a dime. So therefore, you know, that's why the rest of us who have health insurance, or rest of us who may, you know, who have insurance and may not, and have to pay a deductible and co-insurance. That's why it's so expensive, right? Because chances are there could be, let's say 1 a day or 2 a day or 3 a day. People who come to that door don't have to pay a dime because they don't have no insurance. For emergency room care, that is. But as well as the good question is, with insurance carriers involved, like for instance, if you have Aetna, Blue Cross, and United involved in these hospital systems, is a not-for-profit hospital system charging more or less for the same type of service receiving a for-profit hospital? For example, X-ray. Let's just is a not-for-profit hospital charging an X-ray for $30 per X-ray, or is a for-profit hospital charging less? That's a good question. Because if a not-for-profit hospital system is charging more for services versus a for-profit healthcare system, who really knows? Only people who really know is people who work for these insurance companies, right? Unless you can get bills, compare statements from different places you get services from. So that's interesting to know too. If Baylor is charging more for services versus a for-profit company, somebody needs to look into that too. Because then the question is, if they're charging more, their tax exempt status needs to be yanked away from them. But, like I said, when you don't take Blue Cross Blue Shield, the largest insurer in the state of Texas, on the individual market, you don't have no patience. People who have Obamacare, no patience. I don't even think they took Cigna last year, if I remember correctly, nor United. Matter of fact, no, I'll take that back. They did take Cigna. They did not take Aetna nor United. They didn't take those two. They only took Cigna, as well as some of these weird regional players like AM Better Health and Molina and Oscar Healthcare that really no one really uses or sign up for because you really can't go nowhere else. Ironically enough, Baylor, one of the founders of Blue Cross Blue Shield of Texas, was with Baylor Hospital System back in the 30s, and in the form of Blue Cross Blue Shield. So I don't know the reasoning behind why they won't take HMO, and it's another nail in the coffin for this hospital that's shutting down. Like I said, there's going to be tons of physicians that are going to be pissed. I really feel sorry for the patients who may not have access to other hospitals, or have a whole bunch of doctors that are on that hospital campus that cannot, maybe elderly and can't go somewhere else. And I do believe them not taking Blue Cross Blue Shield, I think it was another nail in the coffin that didn't help the situation. There could be other factors as well, but they don't pay 1 cent in taxes, not 1 cent in property taxes. So this should be cleaned up nice, But the quality of services I noticed for the last 10 years went downhill. So it could be that too. When you have a reputation of not providing good care and other hospitals do, well, people are going to use other hospital systems. And unfortunately, I have noticed for the last 10 plus years that there's barely any more independent hospitals. They've all been gobbled up by big corporations like this. There's barely any independent doctors left anymore. Doctors are either in a practice with a couple, like a group of them, maybe 5 or more to survive, or they've been bought out by the healthcare systems like Presbyterian and Baylor. They still be billed and named separately. But if you really look at your insurance paperwork or your EOBs, you can find out if they are billed by a healthcare. So they've been merged with I guess a physician, a doctor nowadays really have no really options left anymore. Either you get a group going, or you get with a giant physician pool to get insurance money. And nowadays, uh, really independent physicians really have no power to get money from insurance companies no more. It's not like it used to be. Um, and you imagine some of the rent they have to pay? Oh, in these office buildings, my God, these fancy office buildings, $10,000 easy. And then they got tons of people working for them. You got the insurance people, you got the people who check you in, and then you got people who check you out. And I think the insurance company's done that to them too. That they make it more complicated than what it needs to be. You have to hire somebody to figure out all the shit how to operate, how to navigate the healthcare system. Each insurance company operates differently. And now, they do all this shit on the computer. That gets rid of all this paper. Supposedly, it gets rid of all this paperwork and medical records crap. But then when you go to the doctor, you have to sign 50 pages full of paperwork. So I don't know. And if you really notice, for the last couple of years, maybe 10 years, that the doctors have a laptop in front of them and they look at the laptop more than they talk to you, really. If you sit down, you just sit back and kind of watch what's going on. The doctor, oh, yes, answer yes to this question, no to this question, blah, 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 blah. I don't know. I think the way our healthcare system is, it's fucked up. And Obamacare made it worse, and I don't think we can never get back the way it used to be. I think the good old days of insurance are long gone. It's not a free market anymore. The individual marketplace is dead. People are screwed. It's a nightmare that we're never going to get out of. Either we're going to be heading to a single payer system, or it's going to collapse. Obamacare's collapsing as it is. You don't hear a hospital closing every day. But like I said, there's a number of factors going into this. But I don't know. It just really, really kind of bizarre, sort of. But when you don't take good insurance, that's what happens. And I also feel sorry for the actual employees. I don't feel sorry for the people who, big old management positions. No, I don't feel sorry for them because they chose not to do this. But I feel sorry for people, the hourly workers, the nurses. I'm sure they can find other hospitals. But you kind of get forced to. I bet you $5 too that they're say, well, we're going to force you to work here, and if you don't work here by the very last day, we won't give you a good reference. I bet that comes to play too. And I think also I'm thinking about. I think Baylor on this particular hospital too. They expanded a lot. They tore down buildings, built new buildings, and I think maybe they had too much debt as well. For the longest time, Baylor was almost becoming a monopoly. Almost. Not quite, but almost getting there. So this is just my commentary.